Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. In this episode, we speak with Nishant Hari, founder and CEO of Predoc, an AI-native health information management company built to make patient records easier to retrieve, organize, and use. Predoc helps healthcare organizations move beyond manual record collection by combining AI with human-in-the-loop support, turning fragmented medical records into structured data that care teams can use before a patient visits. The company has processed more than 10 million pages of data and served over 1 million patients. Prior to founding Predoc in 2022, Nishant spent nearly a decade in finance and derivatives trading at institutions including Citi and HSBC. He transitioned to healthcare after witnessing the day-to-day workflow bottlenecks faced by his wife, a practicing physician, and subsequently built Predoc alongside clinical and technical co-founders to reduce administrative burden and accelerate access to complete patient information. I'm your host, RJ Lumba. We hope you enjoy the show. If you liked the episode, click to follow. Nish, great to see you. Thanks for taking the time.
Yeah, of course. Thanks for having me.
Always interested to chat with founders of healthcare technology companies, particularly in the data space, because it's somewhat daunting. It's an archaic way that healthcare practitioners and clinical researchers have to deal with just outdated systems and ways of getting information. Your story is interesting, I think, because you're not necessarily from the healthcare space, yet you founded a company and are doing very well in scaling it. Tell us about how you came about this idea and your decision to found it.
Yeah. So, my background's more traditional finance. I spent about a decade in investment banking. I was trading foreign exchange and insured derivatives at a few different banks across the street. But I ended up marrying a doctor. So that's how I wandered my way into healthcare and healthcare data. Just for years, just hearing a lot of our workflow pain points around record retrieval, new patient onboarding, patient data retrieval and aggregation. From med school, residency, fellowship, she was just talking about all of the workflow pain points. And even with practicing at some of the biggest academic institutions, in New York and New Jersey, on commercial grade EHRs like Epic, she was still left to do a lot of manual chart chasing, which is their term of having to fax HIPAA authorization forms, call previous providers' offices, get them to fax records back over, and then, figure out what's in that record set, right? So sometimes a, complex patient could have 300-400 pages of PDFs that get faxed over. And then it's on, the clinicians and clinical staff to go through that, index, categorize, and then get the data back into the EHR before the patient comes in to see the physician. So that was kind of the core workflow pain point that we went out to solve. But yeah, very, very different than, my 10 years in banking. I've had to learn a lot, but definitely been surrounded by, the right co-founders as well too.
I mean, it's pretty ambitious to think you can come into a new sector where there's a lot of incumbent technology and there's a lot of other folks in the space that know well that could potentially produce the solution in parallel with you kind of starting your company, yet you have to outcompete them or at least provide a great solution that people will use at scale. What gave you the confidence that you could enter this space and perform at a high level?
Like I've listened to a lot of, really, really impressive entrepreneurs. And I think, they tell a very similar version of the story. And these are entrepreneurs that have done 10x, what we've done to date. But it's almost like if they knew how hard it was going to be, would they have actually gone and done it? And part of it is just, being a little naive and just, trying to tackle big problems. But for us, I think me being an outsider actually gave me some unique perspective. I think if you are in healthcare and you've been in healthcare for decades, you've really been trained to see the world a certain way, right? And it's got to fit that way. Or even if you've been in healthcare technology, right? Even outside of being a clinician, I think it's been one thesis, one worldview. And I think we came in with a different kind of contrarian thesis back then. And we, got some traction and things kind of, quarter on quarter led to, a little bit of momentum and it led to, growth and signal for the market. And I think that thesis that was contrarian a couple of years ago is now, pretty base case and mainstream right now.
If I think about how difficult this process is, where you're taking sometimes handwritten notes or you're having to deal with, formerly documents that were faxed over, to the recipient, it would seem like you would need to spend quite a bit of time on the front end ensuring that your system works prior to launching it. Was that the case? Was there a good number of months where you just worked on the actual solution?
Yeah, I would say it was years, not months, right? If you think about our business, we are AI native services, right, that are automating and completing the jobs we've done for medical records teams across enterprise healthcare. And so, it wasn't just another point solution where we could build a digital data source or digital on-ramp or a tool that existing teams could use. Like we were trying to deliver outcomes, like actually complete the work. And with that framework, you actually have to have human beings doing some of that work, right? Until your models get proficient enough to take on more and more of that work. And that's how we thought about it, right? Like we built what I think is a best in class services organization, right? So like we had humans that were correcting outputs of our models, that were doing some of the more manual offline work, to really be able to sit in the workflows and deeply understand and learn, right? And, like you said, it's not just the happy path. It's figuring out all of the edge cases, right? So it's the handwritten notes, it's the facilities that don't push any data to any of the centralized exchanges, some of the facilities that like mail records back, right? So it's really dealing with all of those edge cases. And the only way to do it is to have your own set of humans doing some of that hard services work and sitting in the workflows for years before you can fully understand how those workflows work.
And as you were kind of designing your solution in your platform, did you focus on one use case? Like, let's just get this one thing right for this particular future customer.
Yeah, definitely. So when I think about the three org jobs to be done for medical records teams, the number one first job to be done is external medical record retrieval, right? So a new patient gets booked, maybe to see a specialist, they get referred by a PCP, and that specialist office is to go out and retrieve all of that patient's medical records, right? And there's a number of ways you can do it, right? You might have access to one of the exchanges like a Care Everywhere, Commonwealth Care Quality, so you can digitally pull some data, right? And then there is a number of records you can't get digitally where you have to get in the old fashioned, like forwarding and faxing manual chart chasing way, right? So, we went out to solve that one core pillar, right, of external medical retrieval, whether it was digitally online retrievals or, manual offline retrievals. And that was the big core wedge for us into customer workflows. And then as we did that really well, we built trust and really earned the right to automate more of those pillars and more of those jobs we've done on medical records teams.
Maybe let's go to present day and hear a little bit more about your current kind of portfolio of customers. Is there a predominant segment in your overall portfolio?
Yeah, I mean, we're very focused on, large tier one MSOs, big specialty organizations and physician groups. That's really the core focus. It wasn't always that, right? When we started, we were working with small outpatient practices, really testing the product, getting quick market feedback, iterating. And then once we, were really able to prove that we were a fit and we had early signals of product market fit, then we continued to go up market, to more of the private equity backed roll-ups, and then made our way to large MSOs and specialty orgs. And now we're pretty far along in the hospital system market as well, too.
Did it go fairly smoothly, this go-to-market and sales process? It sounds like you were able to kind of navigate through these various customer types, customer segments pretty seamlessly. Was it that as soon as they kind of tried your technology, they were like immediately taken by it and said like, okay, let's implement this?
Yeah. First, I think anything relating to go to market in healthcare is challenging. Like healthcare market is definitely not easy. But I do think that we had a differentiated solution very early, right? We weren't selling, another data source or point solution, right? We were pitching outsourced AI services. So it was a different concept, but we definitely found some early design partners and people that wanted to experiment and test this out. And then, we got some pull from some key therapeutic areas, and oncology was one of the first areas. And from there, we were able to really develop anchor customers, like strong champions, and then the organic word of mouth and referrals and introductions that have really helped us kind of expand within those beachhead therapeutic areas. But no, it's definitely hard kind of on the ground work of reaching out to customers, proving ROI, and then having the social capital in the industry to get the buy-in.
Hmm. Can you speak to the competitive landscape a bit? How competitive is this? Like, as you're going to prospective customers, are they saying, well, there's another platform that also offers this, and they maybe have other solutions that go along with it? So we're kind of going to evaluate in parallel, or some could say just not ready, or we're kind of worried about implementing this. Tell us a little bit about just that adoption vis-a-vis competition, vis-a-vis other resistance points.
I look at the competitive landscape in two buckets, right? One are your point solutions, right? All of your big interoperability solutions and data sources, the HIA on-ramps, the explosion of test kits that you can access. And then I think there's another bucket of the legacy, services organizations that have been doing kind of the old school BPO model, right? Where it's like outsourced services, usually offshore. I actually think that we are more competitive with the second bucket, right? Like your bigger legacy BPO players, because we are also pitching AI native services, right? And I think that explaining that to customers, I think was the initial challenge. And then I think we've really learned the language, and it's been a lot easier to present the problem and our solution. I also think it's, one thing that's been compelling that I've heard from a lot of customers is vendor consolidation, right? If you're a point solution and maybe you do one of 5 things in a workflow, right? Or maybe you automate just one of the jobs to be done across, all the jobs to be done for medical records teams. We've been able to come in and say, look, we are the end-to-end platform that does all of it for you and delivers outcomes back. So a lot of customers have understood a combination of getting a better quality at better price versus the legacy services BPO companies, and then also vendor consolidation with a multiple different point solutions.
Hmm. Switching gears a little bit here, you're the co-founder and CEO of the company. Did you find leading a company to be fairly intuitive from what you had been kind of doing previously in, the trading realm?
Yeah, I think the biggest takeaway that I took from my career on Wall Street was the ability to understand the market, quickly iterate, make a decision, and then retest, right? In trading, I mean, you're doing that 10,000 times a day constantly, right? You come up with a thesis on a particular trade, you could validate it, that thesis and build it for, weeks, right? And then you put the trade on, and there could be one tweet that completely changes the narrative, changes your thesis, and you've got to make a split-second decision. And sometimes not only cut your trade, but go the opposite direction. So completely contrarian to your original thesis, right? And I was doing that for years and years, right? So really being able to understand the market signal and act without ego, I think was the biggest takeaway for me, right? And then, building a business, the day-to-day building of a business is something that I've learned. One thing I think as a founder, you need to be able to do is be very, very coachable. And whatever your source of input is, whether it's talking to other founders, other entrepreneurs that you look up to, or reading, listening to podcasts. I feel like I've ingested so much data from reading and podcasts over the last 3 or 4 years that it's definitely helped accelerate some of my learning and knowledge. And I think that we live in a pretty unique time, right? Where a founder can learn so much from other entrepreneurs just by listening to podcasts. It's just a great medium.
Tell us a little bit about your team, your management team. How did you all come together and who does what?
I think that we have really complementary skill sets, right? So, I'm the founder CEO, deal with strategy, fundraising, product vision. My co-founder and CTO is an extremely talented technologist. He's been in startups his entire career. I think his first job at a startup right out of college ended up selling to Salesforce. So I've seen a lot of success from like zero all the way to acquisition multiple times in his career. And then I actually think the biggest value add and thing that I've like really learned from him is his ability to recruit extremely talented product and engineering folks, right? I want to say 85% of our team is a first degree connection, to our CTO. So he's done a great job of having that network. And then my other co-founder, chief medical officer, is an ophthalmologist, extremely talented physician and clinician at practice medicine at every potential setting, from large academic institutions to outpatient practices. So he's seen the full gambit of on the ground, what the workflows look like, all of the admin burden. So really great group of co-founders.
Mm-hmm. You've brought in some outside capital. You have a good list of folks on your cap table. If you could share with us a little bit about the value they bring, aside from the financial capital, but how have they helped your company?
Yeah, we have a great set of investors, from pre-seed all the way through Series A. I think the thing that I was looking for and trying to solve for was like deep alignment and conviction in the founding team. I think when we were out pitching for the seed, it was a very different concept, right? Like AI native services were like a brand new thing. I mean, now there's a ton of knowledge and like a ton of people talking about AI native services, but a couple of years ago, it was still pretty new. And I think like, honestly, just having that thesis alignment and conviction analysis, like one of the biggest things that they've given me, and maybe more operationally and tactically, they've done a great job, like helping with recruiting. They've got a great pipeline of candidates that they put in front of us and have helped us close some really impressive hires, in other key leadership positions. So a combination of like strategic thinking and thesis alignment.
We're coming up on the tail end of the conversation. I have two final questions. One is, can you tell us about a person who has had a profound influence on you?
This may be a little cliche, but my dad, first generation immigrant, very similar kind of story to a lot of other immigrants, right? Came here with a couple of suitcases and vision of the American dream that he wanted for his family. And, I think it's that like entrepreneurial drive that we think about, leaving a career in banking to jump in and take a risk.
Did he immigrate to Texas? Because I know you went to UT.
Yeah, so we actually got into the master's program at Texas A&M, and that's like how we ended up coming. So yeah, grew up in Texas, but he's an admin. I'm a Longhorn, so we've got some like interesting moments in Thanksgiving.
The last question: can you tell us about a charity, cause, or other endeavor that you're passionate about?
Honestly, like I really think that the work we're doing at Predoc is some of the most important work that we could be doing, or honestly, the most impact that I could be having, across anything that we potentially could be working on, right? I really think that, over the next like 10 years, we are going to have a massive shortage in healthcare labor, especially on like the nursing and physician side. And, anything that we can do to lower administrative burden and help add velocity to our clinicians and our frontline staff that will eventually be taking care of us and our children is probably the most important stuff that I could be working on right now.
Wonderful. Well, Nish, I want to thank you again for taking the time. It's been a great conversation.
Yeah, thanks a lot. Thanks for having me.